A new study shows a blood test can catch almost all early dementia cases. Researchers say this is a game changer and could lead to an earlier and more correct Alzheimer's diagnosis.
Yeah, so joining us now to break down this study and what else it could mean for people getting tested for Alzheimer's is our 9 Health expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning, guys.
Why has this test created such an impact?
It is so dramatic in the medical community because for the longest time we have struggled with how to diagnose Alzheimer's correctly. So, Alzheimer's is the most common form of dementia, and really what it's characterized by is these deposition of these plaques in the brain called amyloid plaques. And the only ways that we've been able to pick them up is either by a spinal tap, which you can imagine is very invasive, or this very expensive PET scan that helps to detect it. So when people present with dementia, we don't know whether it's Alzheimer's or another form of dementia, and that's where this test, which is a blood test, just like a cholesterol test would be, has really going to change the landscape of how we diagnose the disease.
How accurate is it?
Extremely accurate.
Wow.
That's what really has knocked our socks off, because the test itself can detect this protein called p-tau, which is basically a marker of those amyloid plaques, but in the blood. So it's a blood marker of plaques in your brain that are causing damage to the neurons, and it detects that with 96% accuracy. Now, if you combine this test with the second blood test for Alzheimer's, those two combined tests actually have a 91% accuracy for saying that your dementia is Alzheimer's or it's not. Now, if you compare this to how well doctors perform, only 61% accuracy for primary care doctors and only 73% accuracy for specialists like neurologists.
So this is really good news. How is this going to impact care for Alzheimer's patients?
I'm hoping that it's going to transform care in two ways. So first, it's going to make the diagnosis of Alzheimer's earlier and more accurately. So one of the challenges that we have with Alzheimer's, we don't know that it's Alzheimer's till it's too late, because that damage has to accumulate over time. It manifests with more and more symptoms, and that's when you do those invasive, expensive tests. So by moving the diagnosis up earlier and doing it kind of more accurately, hopefully you can get people, plugged into treatments. The other thing it does is it rules out Alzheimer's much more accurately. So you have 20 to 30% of dementia is caused by other things, that these are people waiting to see neurologists thinking they have Alzheimer's, actually clogging up the wait list for neurologists. So this kind of a test could actually shrink that wait list by 6 months to 12 months.
Wow.
Really get people who do have Alzheimer's into that neurologist, the ones who don't, get them treated for their other conditions.
So if there's limited treatments right now for Alzheimer's, why get the test? I mean, is it like just so you know?
Well, that's a really important question. So if you think about it, like knowing early on, even in your 30s or 40s, that you have these amyloid plaques in your brain certainly can be jarring and disturbing, because you're headed for Alzheimer's. But we now do have some treatments that can target these amyloid plaques and clear them from the brain. But the catch-22 with those treatments is you can't use them too late in the disease. So you have to use them at the sweet spot when you have just enough plaque, but not too much plaque. So number one, it could line you up for those treatments if you do find out you have plaque. And number two, you could change your life in other ways.
Right.
That could really reduce your risk of dementia. So this test is not for the worried well. So I want to be clear on that. It's not for people who are worried that they're going to get Alzheimer's and they want to check. It's for people who already have cognitive impairment, early cognitive impairment, and for them we can really sort of help decide how we can reduce their other risk factors for dementia, vascular risk factors, high blood pressure, high cholesterol, diabetes, metabolic syndrome, lack of activity and such. So I think this is a really important test in science. It's not quite in the clinic yet, so you can't go ask your doctor for it today. But within the next year, there'll be validation studies, and hopefully we'll have it soon to offer people.
This is going to be a game changer in the best possible way. Thank you, Dr. Kohli, for that. We appreciate it. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Let's